My name is Matthew Surburg, and I'm a family physician. I've been here at Hancock Regional for 14 years. Well, when I first graduated from residency, I actually started at the office in New Palestine, and so that was, still within the Hancock umbrella, but that was before we had gone on the computer system, and so everything was on paper, and so obviously it was quite a bit different then. I think one thing that I really enjoy, and one thing I find very satisfying, is when I see somebody back, even in the office, and they say, Doc, I did what you suggested, and I feel better, it worked. That to me is very enjoyable because, again, I feel like I've really helped that person. I really enjoy having the opportunity to get to know them and to feel like I'm really contributing in a positive way to their lives over the long haul, over their lifespan. I enjoy working with multi-generation families, so I see the parents, I see the grandparents, I see the kids, and I understand really better what the dynamics are within the family. Well, everyone's different, so it's hard to say that I have a single philosophy for everyone. Some people are their problems are very simple and they're easy to meet. Other people are really much more complex from a medical standpoint, and so they require certainly more time, but some people require a more deliberate effort to tease apart the different problems, and some people really their need is more social. They're there partly to get refills or partly to get medications, but partly just for social interaction and to talk. And so I try and when I have the opportunity, take a little more time with them. And I have one or two patients that we'll trade jokes and that sort of thing. We try to again, I customize it to each situation, but I try to understand what the patient's need is and then meet that. Well, certainly the experiences that I have with my children and with my wife inform just my understanding of what happens with people in their lives. So, if I'm dealing with parents who are struggling with a baby that's not sleeping through the night very well and is probably old enough to be able to do so, I can draw on my experience and say, here's what happened with my kids. And I don't always necessarily have the answer, but people appreciate the fact that I've been through that and I know what that feels like, and I think they maybe they don't enjoy it, but they at least find that there's some credibility there. And again, that those are experiences that I can simply draw upon in my own practice. I would say that in my office, we have, aside from me, 2 other physicians and a nurse practitioner. We have a really good team that works together. We have a fantastic office manager. Everyone on the staff is really good, whether it's the nurses and MAs, the people that handle the phones, the front office. Everyone works really well together. We all get along well, and so it's just a really good environment for me to work in, but also for patients to receive their medical care. My family actually comes to our office too. One of my partners, Dr. Kuti is a physician for the rest of my family. When I'm with somebody who needs extra time, I'm going to go ahead and take that time, and patients usually understand that. I'll explain that obviously I'm very limited in what I'm allowed to say about other patients, but I will say there were some people who needed extra time, or if it was a computer problem, or if I had to step out for a C-section or for a phone call from the ER, I'll at least give the patients a little bit of understanding of, this is why my time has been taken up, this is why I'm running behind, it's not because you're not important. And people really appreciate understanding that. And then I've had people tell me, I understand you'll take the necessary time for me, so I don't mind if you do that for somebody else.